Welcome back to the podcast of Heal Without Harm. My name is Dr. Clayton Dir, physical therapist and the one bringing you the truth about the medical system. Today's podcast is completely about your first visit with a physical therapist. You're going to learn a little bit about what to expect, about what to bring, what to prepare for, and my goal is to also bust a little bit of myths that I usually hear on social media, hear from friends. Honestly, I can tell people think certain things just based off conversations and the questions that I get. So I want to address all these, give you a little bit better understanding of what to expect, at least at our clinic, and maybe some red flags or yellow flags to keep an eye out for when going to a clinic near you. So most of the time people end up in physical therapy because they were either referred to a physical therapist by someone like myself on social media. Maybe they were referred by a friend or family member. Maybe it was post-surgical, or maybe they went to the regular medical doctor and they were referred to PT from there. I think I will take a portion of today and compare a PT first visit to a medical doctor first visit, but this is primarily going to be about what to expect day one walking into a physical therapist. Let's start with myths. So a lot of the times people joke how PT stands for physical torture and it's all about pain. But I'll tell you what, most PTs that I know of at least, their goal is to make your pain go away. And one thing that always frustrated me when I was going through school is the amount of physical therapists that I was actually with that I felt like patients didn't walk out in less pain than they came in with. They definitely didn't leave in more pain, don't get me wrong. But my goal every time someone comes in is for them to feel better on the way out. And so that's what I want you to know is that the goal of each session, specifically the first 1 to 4, is all about pain relief. The goal is to reduce it, not force you to push through it. There are times where there's going to be discomfort that we need to work through, but usually on day 1, the goal is to get rid of pain. You should leave feeling better, not worse, and at most, a little bit sore. So when you come in for your first visit, I mentally break it up into 4 parts. Every visit with me or physical therapists similar to me is going to be an hour long. And if you break it up into 4 parts, it generally breaks down to about 15 minutes in each section. So section 1 is I will already have all your paperwork and have it reviewed. And I usually have notes written up on the board of specifics that I want to talk about. The first 15 minutes, I will hear your story. I'll ask you questions. I always joke how I usually interrupt people just to get clarity. I say, go ahead and tell me your story, and then I'll play 20 questions, jump in here and there, and ask for clarity. So you're going to get 15 minutes of probably pure conversation, 2 to 3 times that what you normally get at the medical doctor, like for your whole visit. The second portion of the evaluation is going to be 15-ish minutes of physical assessment. So we're going to have you stand up, take your neck and shoulder through some range of motion, strength testing, special tests, so some specific tests for specific tissues. If it's a lower body thing, we're going to be doing trunk mobility, hip strength, knee stability. We will test ligaments, meniscus. We will test your stability. So how well can you balance? How well can you hold a position? How many reps can you do of different movements? It's all going to be extremely dependent on the person. It always blew my mind when I would sit back and watch a student of mine, or when I was a student, I would watch the PT, and it would blow my mind how we can evaluate, assess, treat, and really help people with jaw pain, headaches, shoulder pain, wrist pain, knee. I mean, pick any joint in the body. And the assessment is so much different. And so that's what we will be doing in that second part of the hour. So that 15 to 30 minutes, we are pretty much playing detective work for the body. We're trying to figure out why you're in pain, what tissue is affected, what is this changing for you, those kinds of things. We're essentially fine tuning what we already theorized in that first 15 minutes. Step number 3, let's get you out of pain as much as possible. So this is when we are doing hands-on work. We as the PTs doing hands-on work to you to try to make pain go down. Most of my people are going to get something called dry needling. If you haven't heard of that, or you don't know what it is, or you want more information, 3 to 5, maybe 8 episodes ago, I did a whole podcast over dry needling. You can go check that out. Dry needling is usually my number 1, but we also offer things like soft tissue release, IA stim, so instrument assisted soft tissue mobilization, joint mobilizations, stretching, contract, relax. There's all of these different modalities that we can do to make pain go down. Some visits may include much more. Usually the first couple visits, they're much more manual heavy because we're trying to get your pain to go down. Not always do we do it, but most of the time we do, because either it just feels good, it helps relieve pain, it helps gain range of motion, helps muscles contract a little bit better so that we can get more out of the strengthening aspect. But that 15 minutes will be mostly pain relief. To finish out, on day one, we are going to give you generally 2 or 3 movements to go home and work on, because there's a lot that we can get done within that hour, but ultimately it's all about lifestyle change, modification of warm-ups, increase of workouts or walking, or sometimes decrease for that matter. Sometimes people are doing far too much, but we're going to give you some tangible takeaways, and we usually follow up with an email or in our app called True Coach, sending you stuff to work on between visits that we will modify and adapt that as we go along. I would say, I said that we had a lot the last 15 minutes for that, but usually it seems that's about 5 or 10 minutes, and then we have 5 to 10 more minutes of questions because we cover a ton of information on day one, handle scheduling, plan of care, recommendation. And actually, this would be a good time to let you know that at least at our clinic and a lot of the different cash-based or out-of-network clinics that I know of, generally, when prescribing a plan of care, we talk about our 3-step process. And so if we go 10,000 foot view, we're going to take you through the 3 phases of reset, restore, and reload. Reset would be reset your pain cycle, trying to get pain down, because unfortunately, when you're in pain, you move differently. Sometimes that different movement causes more pain. And then because you're in pain, you move differently. So think about all the compensations that come over time when you move to dodge the pain. Step 2 is restore full strength and range of motion. I always tell people between step 1 and step 2, that's usually where normal physical therapy drops off. The pain is gone, so they kick you out the door. Insurance stops paying. They say, you've had enough visits, whatever. That's usually where that ends. But stage 2, reload full strength, restore full strength and range of motion. That is the most crucial, because that is the time that you make the gains without pain. You're out of pain generally at this stage. But this is where you go fix the things that led to you having the pain that led to stage 1. So if you do stage 2 right, restore full strength and range of motion, you're much less likely to go back into stage 1. This is the downside of physical therapy when you have to get kicked out too early due to insurance or due to the PT discharging you prematurely, is it's not too long before the pain comes back, because we essentially got the pain to go down, maybe isolated the right tissues, but we didn't solve the problem that led to the pain in the first place. Stage 3, this is reload your tissues. This is the stage that is usually 3 to 4 weeks between visits. Maybe it's month to month. Maybe you're discharged after just 1 or 2 month to month visits. This is where I tell people you need to go put miles on your vehicle, aka you need to go just live your life and see how you do. Go back to your workouts full speed. Maybe we push the limits a little bit more. You run a little bit faster, jump a little bit higher, lift a little bit more weight, and let's see how you do. And then I'll hold your hand just a little bit longer there at the end. Or maybe you stay coming in month to month for some tune-ups. That's what a usual plan of care looks like in the thing. The whole 10,000 foot view, like I said. And that's what we'll cover at the end, right after we tell you what the homework is. Most of the time, we see people once a week for the first 4, 8, or 10 weeks. And then we start stretching that out every 2 weeks, every 3 weeks, every 4 weeks. Traditional PT will see you 12 times in 6 weeks. So they will see you 2 times a week for 6 weeks, and then you're done. Unfortunately, physiology generally takes 8 to 12 weeks to build true strength and actually make lifestyle change. Pretty sure the last research that I saw says it takes 66 days to build a habit. Well, 6 times 7 is 42. So you could get through an entire plan of care with a PT in 42 days, 12 visits, so 12 times taking off work and everything, and you haven't even completely built new habits. And that's why a lot of times they fall flat. But most of the time I see people 10 to 15 times over a 4 to 7 month period. So let that sink in. I will see you about the same amount, sometimes less, over a 2, 3, or sometimes even 4 times as long of like time span. So we can work together for a longer period of time, but you take off work less, you come in less, and you actually get tangible takeaway benefits. That's the difference between in-network and out-of-network PT quite often. And so those are some things to consider when trying to find a good physical therapist. Now, some other things to look for, to know whether or not you're in the right clinic. Some red flags: the visit is rushed. You feel like you're in a cookie cutter treatment. Oh my gosh. Here's the way. If they hand you a printed off piece of paper that tells you to stretch your calves, stretch your hamstrings, stretch your quads, stretch your glutes, do some calf raises, do some sit to stands, and do some planks, and that's like all. It's like 30 minutes of work. It was printed off in the 1980s and then just photocopied since then. Please, 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 just you probably just need to leave that clinic. It absolutely just kills me. If you don't feel like the PT knows what's going on, they don't offer explanation, yellow flag probably on that, because I know there's some times where I know how to help the person on the next step, but I don't know exactly what's causing, but I'll explain that usually quite well in the evaluation. If every visit you show up, you get on the bike, not with your PT yet, you ride the bike, then you talk to PT for about 20, 30 minutes, go through your normal homework, and then they just put you right on some heat, e-stim, traction table, and it's just like that every single time. And you don't feel like you're actually getting stronger, loading your joints, making lifestyle change. Also, red flag. If you look around the clinic and you don't look anything like anyone else, nobody there you feel like gets you, whether it's other clients or the PTs, they just don't understand what you do. Maybe not the right spot. Maybe a yellow flag. Like, unsure about this. Some green flags though. You feel like it's personalized. They get you. They pass the vibe check. You feel like they're answering all your questions. You feel like you're getting exercises specific to your mobility deficits, your strength deficits. They're laser focused at getting you back under the bar, back on the track, back on the field, back on the pavement if you're a runner, back to doing what you want to do. If there's a clear plan, just like I illustrated here in this podcast, and if there's clear, good communication that's going to be had throughout this process, because you're going to be spending some time with this PT. They're going to be walking you through some challenging times. You need to make sure that you're a good fit with this person. They're a good fit for you. And so these are some things to think about when you're in a clinic on whether or not you want to stick with this one. Lastly, just some little stuff. What to wear. Wear something comfortable. You might be doing squats. You may be doing some jumping. You may just be doing some mobility stuff. Think gym-like clothes. Guys generally are fine with taking their shirts off if we need to look at shoulders and work on some stuff. But ladies, please wear sports bras, tank tops, something that you're comfortable giving us exposure to your shoulders, shoulder blades, neck, lower mid back, all that kind of stuff, so that it just makes it easier when it comes to assessment and then also treatment. When it comes to pants or like lower body, stretchy pants are helpful. I know sometimes short shorts that are very baggy sometimes make it challenging to work around the hips, the quads, the hamstrings and stuff. So compression garments are usually a little bit more helpful. It's easier to drape if needed, identify muscle insertions and attachment points and stuff like that. It just makes it a little bit easier, especially if it's male to female. And so keep that in mind as well. Things to bring is any imaging reports or any other doctor's things. Most of the time that's going to be the paperwork, so you don't need to worry about that too much. If you ever have questions, just reach out to the PT ahead of time. So, excuse me. On this first visit, it's all about building trust, getting answers, and really just understanding the path moving forward to healing. If you've been putting off PT because you're nervous, trust me, you're not alone. But most people say they wish they had started sooner. That's what I hear most often is, where were you 2 years ago, 5 years ago, 10 years ago? They wish they would have came in sooner. Most of the time, people don't realize you can go to PT first. You don't need to go to a medical doctor in most states. And so just reach out to the PT and ask some questions. See if you can just go straight to them. It'll save you time. It'll save you money. And honestly, it'll get you back to doing what you want faster and get you out of pain faster. If you've liked this episode, please share it with some friends. Share it with anybody that you think needs it. If you've got that friend down the street that's been having knee pain, send this to him. If you've got that brother, that mom, that cousin, that dad, that grandpa that's got shoulder pain, hip pain, back pain, whatever it is, please send this to them, because I want more people to realize what it's like to go to physical therapy and how helpful it will be for them. And then also how not to go to the clinics that aren't helpful, how to dodge those. And so knowing what red flags to keep an eye out for. To finish out, I want to say thank you. Thank you for listening. Please share this to your stories on Instagram and Facebook. Tag me and I will share it back. I love seeing these things. I also want to have a little bit bigger push for reviews. We've got a lot of them, more of the ratings. If you want to jot down a little paragraph and tell us what you'd like about the show, that'd be fantastic. I know that's one of the fastest ways for us to grow is just leaving a rating and review and then sharing it on your story. So thank you if you've done that. And thank you if you're going to do that as you leave here. Also in the description, I always have a little Google form if you have any suggested guests that I need to have on the podcast, or if you want a suggested topic, you can go fill that out as well. To finish out, lastly, one more time, thank you so much for listening. If you have any questions, please reach out on one of the socials. You can follow me at the Doc Dir on Instagram, on TikTok. You can find me at that name also on YouTube and Facebook. Thank you so much. I hope today you learned a little bit more how to heal without harm. See you later.